Hey everyone, and welcome. So today we're going to dive into a condition that's way more common than you might think, but also kind of misunderstood. We're talking about goiter. You've probably heard the word before, or maybe you've even seen what looks like a swelling in someone's neck. So what is actually going on there? Let's get into it.
And that's really the big question, right? Seeing a swelling at the base of your neck can be a little unnerving for sure. But a lot of the time, it's a sign that your thyroid gland is just, well, it's working overtime. We're going to break down exactly what that means, why it happens, and what you can do about it.
So to really understand this, we've got a clear plan. We'll start with the basics. What even is a goiter? Then we'll get into the fascinating reasons why it happens, walk through how doctors figure it out, check out the latest treatments, and then wrap up with how to prevent it and what the overall outlook is.
All right, first up, let's get on the same page. What exactly are we talking about when we say the word goiter? And does it always look the same?
Okay, so this is the most important thing to get right off the bat. A goiter isn't a specific disease. It's more of a sign. It just means that your thyroid gland, that butterfly-shaped gland in your neck, is bigger than it's supposed to be. It could be something a doctor sees or feels, or maybe it just pops up on an imaging scan. The bottom line is the term goiter simply means an enlarged thyroid.
Now, goiters aren't all the same. They can show up in a couple of different ways. On one hand, you have a diffuse goiter. This is where the entire gland swells up pretty evenly, so it feels smooth. But then you have a nodular goiter, which, as the name suggests, is lumpy. That's because one or more nodules, which can be solid or filled with fluid, have grown inside the thyroid. So if a goiter is just the thyroid getting bigger, that begs the real question, why? Why does the thyroid enlarge in the first place? Well, the reasons are pretty varied, and honestly, they're super interesting.
Get ready for this number because it is absolutely massive. The single biggest cause of goiter around the world is a simple lack of iodine in the diet, and it affects an estimated 2.2 billion people. That's billion with a B. It's a huge public health issue, and it's the main reason for what's called endemic goiter in many parts of the world. So how does a lack of iodine actually cause this growth? Well, think of your body's hormone system like a smart thermostat. If you don't have enough iodine, your body can't make enough thyroid hormone. The pituitary gland in your brain senses these low levels and starts cranking out more thyroid-stimulating hormone, or TSH. TSH is basically a message shouting at your thyroid, hey, we need more hormone, work harder, get bigger. And all that constant stimulation makes the gland grow. But you might be thinking, hang on, I use iodized salt, I live in a place where iodine deficiency isn't really a problem. And that's a great point. In regions where there's plenty of iodine, the causes totally shift. The most common culprits become autoimmune conditions, like Hashimoto's disease, where your body mistakenly attacks the thyroid, or Graves' disease, where it overstimulates it. Things like genetics, certain meds, and even just benign nodules can also cause a goiter. Okay, so let's say you or your doctor has noticed a swelling. What happens now? What's the game plan? The good news is the diagnostic process is really logical, and it's all about figuring out not just if you have a goiter, but more importantly, why. This really maps out the whole process. It almost always starts with a simple physical exam. From there, a blood test can check your hormone levels. Then an ultrasound can give a really detailed picture of the gland. And only if something looks suspicious, a biopsy might be needed to get a closer look at any nodules. And that first step, it's surprisingly low tech, but tells the doctor a ton. They'll just, feel your neck to check the size and texture, and they'll probably ask you to take a sip of water and swallow. You might wonder why, but it's clever. When you swallow, your thyroid gland moves up and down, which makes it much easier for the doctor to feel its shape and check for any lumps or bumps. Once the doctor has all the info and there's a diagnosis, what are the options? The key thing to remember is that there's no one-size-fits-all answer. The treatment really depends on the cause of the goiter, how big it is, and whether it's actually causing you any problems. First, let's talk about what are called non-toxic goiters. Now, that just means the goiter is enlarged, but your hormone levels are totally normal. And believe it or not, a lot of the time, the best approach is just observation or watchful waiting. If it's small and not bothering you, your doctor might just keep an eye on it. Now, if it gets really big and starts pressing on things, surgery is an option. And for people who aren't great candidates for surgery, radioiodine therapy can be used to shrink the gland down. Now, for toxic goiters, the story is a little different. Toxic here means the thyroid is in overdrive, pumping out way too many hormones. So the goal is to calm everything down. Antithyroid drugs can help control hormone production, but for a more permanent fix, radioiodine therapy is often the go-to treatment because it's super effective. And of course, surgery to remove the thyroid is always a definitive option, especially if other treatments don't work.
All right, so let's bring this all home. What's the big picture here? What's the outlook if you have a goiter? And more importantly, is there anything you can do to keep your thyroid healthy in the first place?
This quote really sums it up perfectly. For a simple goiter, the outlook is actually really good. It's something to be managed and monitored for sure, but it is rarely a life-threatening problem. It's a condition to be aware of, not one to be afraid of.
And this right here just shows how powerful simple prevention can be. The recommended daily intake of iodine is just 150 micrograms for most adults. To put that in perspective, that is an incredibly tiny amount. We're talking way less than a grain of salt. But that tiny amount is enough to prevent the #1 cause of goiter worldwide. For most of us, using iodized salt and eating a balanced diet gets us there easily.
And that really leaves us with a pretty incredible thought, doesn't it? The idea that one tiny trace element can be the difference maker for a health issue that affects literally billions of people. It's just a powerful reminder of how connected our health is to even the simplest parts of our nutrition. Thanks for joining me for this explainer.